Hi, my name is Dr. Cioe-Peña, and welcome to the Path Forward Ask Me Anything. I'm very happy to be here today. My name, like I said again, is Eric Cioe-Peña. I'm the Director of Global Health for Northwell Health, and I'm also an emergency physician, and I have a degree in public health. So I'm excited to answer your questions today, and why don't we get started? So our first question, great opening question, where do we currently stand on vaccination efforts in the United States? So the United States is currently at about 160 million people vaccinated. Obviously, there's a skew towards older Americans being more vaccinated, with some states having over 90% of their elderly population vaccinated. And we're now seeing kids as young as 12 years old, all the way up to the, to 100, end of life, getting vaccinated for COVID-19. We are far ahead of any other country in the world. And that is a great accomplishment given the challenges that we've had in rolling out the COVID-19 vaccines. But we're doing very well. We need to continue on it. I know that the federal government has a goal of having 70% of Americans vaccinated by July 4th, 2021. And it looks like they're on track to meet that goal. And so we're hoping that people continue to get vaccinated, and it gets easier and easier to do as we move through the summer. Let's see, our next question. So if a person's been infected with COVID and recovered, is it necessary to become vaccinated? So I get this question a lot. This is actually a really important topic, because the immunity that's generated from getting infected with COVID is not the same or as good as immunity generated by the vaccine. When you think about it, when a virus is in your body and your immune system destroys it and is trying to learn what parts of the virus are important to detect, it's seeing all these different fragments of the virus, and not necessarily the part of the virus it's going to see when it's not destroyed. So you'll have antibodies that are generated to parts of the virus that are inside the core of the virus. It'll never get seen when you're first exposed to it. The vaccine actually hones and teaches the immune system to recognize that spike protein that's on the virus's surface, which is what the virus uses to infect a human cell. So the vaccine provides much better immunity than getting infected with COVID, which is why we see people going past 90 days and still not getting infected with COVID after being vaccinated. So it's very important to get vaccinated, even if you've already had COVID. It's gonna reduce your risk of getting infected again or having severe symptoms if you did get infected. All right, let's move on to the next question. So when will something more definite come out about if and when boosters will be needed, and are we going to be ready when that time comes? So I think one of the things that people are confusing is when the pharmaceutical companies mention that they're making boosters. I think there's a lot of inference there that we know that we need a booster. And fortunately right now, we don't know that yet. We're still following all of the people that were vaccinated in clinical trials, which began at about July of last year, that are still immune to COVID-19, and we're basically waiting to see when that immunity starts to fade. In some vaccines, you can get lifelong immunity. In most coronaviruses, we've seen that immunity lasts anywhere from a few months all the way up to lifetime. So we don't have a lot of good experience with COVID-19 on which type of coronavirus it will be. Obviously, the immunity's lasted longer than a few months, which is what we have with the common cold, but it's probably not going to be as long as lifetime. I think people are estimating it's going to be that we're going to need a booster around a year after we get vaccinated, or if we're lucky, maybe 3 or 4 years. But it's still too early to tell. We've got to follow those people that were initially vaccinated and measure their immune system and see when that immunity starts to fade. All right. So now that vaccinations are available for ages 12 and up, when do you expect the vaccines will be approved for the youngest children? So trials are ongoing right now. We are, Pfizer and Moderna are both actively enrolling 6 months to 11 years old in clinical trials. There is expectation that they will have data from those trials, if everything goes well, by the fall, and that we should have an EUA, or an emergency use authorization, in front of the FDA by about September or October of this year, which is great in terms of news for the youngest children. But still not ready for prime time yet, and we need to see what those studies show. If it's anything like the data that we had from the 12 to 16-year-olds with Pfizer, it's going to hopefully be a really good vaccine for the youngest population as well. So the next question is, what would you say to parents who are hesitant to give their vaccines to their kids due to how it might affect their future development? So I get this question a lot from parents. Parents are obviously worried about their children. They want what's best for their children. There is no evidence to date that the vaccine type or that vaccines in general cause any developmental problems in children. Vaccines are safe. They actually prevent diseases which cause developmental problems. And I think anyone who knows someone who's suffering from a COVID long hauler symptom will know that, you know, your risk of blood clots, your risk of neurologic issues are all worse with getting COVID than they are with getting any type of vaccine. So, and the mRNA vaccines are super safe. The genetic information they encode for can't enter the nucleus of a cell where our DNA is stored. They stay in that kind of main part of the cell and help generate immunity, but they don't do anything to our genetic code or affect our development. I'm actually, personally, I'm very excited to vaccinate both my children. My children are 6 and 4, and I wish I could get them into a clinical trial, or I wish I could get them vaccinated as soon as possible. I have no reservations at all about vaccinating my children. All right. Moving right along. So if you'll need to get vaccinated yearly or receive boosters sooner than a year, will it be important to continue with the same manufacturer of vaccine, or can they be interchanged, i.e. J&J and then Pfizer? So in theory, all of the vaccines generate immunity to the same type of virus, which is SARS-CoV-2, which causes COVID-19. So you shouldn't have to stay with the same manufacturer. I'm sure the manufacturers will say that they would recommend that if you got the Moderna, you stick with Moderna, and that makes sense from an economic standpoint for them. But in all essences, they're training your immune system to detect the same virus, and they probably can be interchanged. So even if you got the original Pfizer vaccine and you wanted to get what was available was a Moderna booster, I would recommend that patients get a booster when it's recommended by the CDC, and that they can get any booster available. A great question. So let's see, if a person is immunosuppressed and has had an allergic reaction to vaccinations before, would you still recommend that they get the COVID vaccine? Well, I think immune suppression is definitely a good reason to get vaccinated. You're more likely to have a bad outcome from COVID as well. The allergic reaction to vaccines, so people who have had allergic reactions to anything in the past have a higher likelihood of having an allergic reaction in the future. So I definitely would wait the 30 minutes that's required observation after getting vaccinated. I would do it at a center that has a medical professional available and has EpiPens on hand, which most vaccination centers do. Certainly at Northwell, all of our vaccination centers have an emergency personnel and an anaphylaxis kit. But I think that the risk benefit still is in favor of getting vaccinated, despite the small risk of anaphylaxis. It really was overstated in the first couple of months of the pandemic, and really we're seeing levels of allergic reactions to these vaccines that are no greater than any other vaccine that we've made or any other medication that we've given, in all honesty. All right, so next question is, vaccine hesitancy appears to be highest in young people, communities of color, and Republicans. How can we address for each of these groups? So I want to be careful here because we've only vaccinated between 30 and 50% of the United States right now. And I guarantee you that 50% of the United States is not vaccine hesitant. I think there's a category of vaccine hesitancy, which we can talk about in a second, but I want to make sure that we understand that the numbers right now aren't necessarily representing vaccine hesitancy. What they're representing are that we have a group of people that won't go to mass vaccination centers, won't go to car drive-ups for vaccination, want to have a discussion with their doctor before they get vaccinated perhaps, or a healthcare provider, and then will be willing to get vaccinated. So I think there's what we saw in the beginning of the vaccination portion of this pandemic was people that we're going to get the vaccine no matter what, and we're going to do any lengths to get the vaccine. We now are dealing with the second group of people, and that second group of people really aren't against the vaccine. They just don't want it to be an inconvenience, don't want to lose work, and want to understand it from someone, medical provider that they trust. And I think we need to focus on that group right now. In terms of vaccine hesitancy, really, I've found that it's just providing information. It's Ask Me Anything like this. This is one of the reasons why I said yes to the Chamber of Commerce in doing this, is that the more knowledge that people have, look, this isn't a hard decision. This is a decision that you need all the information to make. But once you get all of the information, this is pretty much a slam dunk decision. People are seeing for the first time in our modern history kind of the result of a vaccine preventable illness now. So we've seen the 500,000 plus people that have died from this disease, and now we have a vaccine available. And this has been an easier conversation for me than talking about measles vaccine, for instance, because most people in our age haven't seen measles, haven't seen a death from measles. And so being able to talk to patients about the risks of COVID and the risks of vaccination, the risks of COVID far outweigh the risks of vaccination. And I think most people in all three of those categories that were mentioned understand that. I also think I want to make a particular note about communities of color. We need to be really careful about assuaging vaccine hesitancy or putting vaccine hesitancy as the reason why communities of color aren't getting vaccinated. They are traditionally underrepresented in healthcare. They traditionally live in healthcare deserts where there aren't healthcare providers or readily accessible health facilities. And they also are more likely to have jobs that are inflexible about work hours and wouldn't allow them to get to a vaccine center. So I think there's a lot of societal barriers that we need to address before we truly label someone or a group as vaccine hesitant. But a great question, and certainly something that I think about a lot. All right. Do you think more vaccines will come to market in the coming months? Yes, I do. I think there are going to be more vaccines in the market. I also think that there's a couple of exciting options or exciting possibilities for second generation vaccines that won't need boosters and won't need coverage for variants. And so, we're seeing this with the flu vaccine race. There's right now a flu vaccine candidate that would work with all of the variants of flu. So you may know now, traditionally, each year we have to get a new flu vaccine because the flu mutates and changes, and the vaccination that we had a year ago won't hit the flu that we have this year. And we have to kind of guess as to what the prevalent strain of flu will be. Well, there's definitely companies working on vaccines right now where you get one flu vaccine and then that's lifelong immunity against flu. There are also in the pipeline coronavirus vaccines that would vaccinate you against kind of all of the coronavirus variants, from the common cold all the way through COVID-19. And those are really exciting developments. And the jump to this mRNA technology has really made things possible. We can change how vaccines are produced and change the message in that messenger RNA much quicker than we could with traditional vaccine vectors. So it's a really exciting time for vaccines against cancer, flu, and coronaviruses. So I'm very excited for the second and third generation vaccines. All right. Any thoughts about when international travel might loosen up? And what about vaccine passports, testing prior to departure and upon arrival, et cetera? So I definitely think that we're going to see international travel over the next couple of months open up. We've already seen, the European Union just voted to allow Americans to travel again. If you're vaccinated, you're able to travel to the European Union. We've seen a lot of countries kind of remove the United States from its no-fly, no travel list. In terms of how to prove that you're vaccinated, this is definitely a debate. It's a hot topic. There are some states that have already come out with its own technology, like in New York. They have a pass that's a QR code that on your phone that verifies you've been vaccinated. Obviously, everyone knows about the white CDC card, which is our low-tech way of proving vaccination. And those are, traveling and having to show proof of vaccination is not a new subject, right? For those of you that have traveled to countries that have battled yellow fever, showing your yellow fever card prior to gaining entry to the country was kind of a regular part of that. And so I think that we're going to see something like that, hopefully a little bit more technologically advanced than just the white card, but it's definitely on the horizon. And I also think even domestically, we're going to start seeing more large venues looking at changing their policies based on whether you're vaccinated or not. And I think that's just an inevitable part of our future. All right. So what about vaccination efforts outside the United States? Are you concerned about hotspots in India or other places, or what could that mean for our own recovery here? That is an excellent question. That wins the question of the session. That is a very important part of our fight against COVID, and I think we need to drill that home. What happens in India can and probably will affect us. And right now, we haven't seen a variant that dodges the immunity that vaccinations provide. But the more that we allow the rest of the world to burn around us with COVID, the more at risk we are that a variant could get generated that could dodge some of the immunity that we've generated from the vaccine. So it's very important that we continue the fight globally against COVID. that we provide vaccine to nations that aren't able to buy vaccine because it's not on the market right now, and that we look at the global vaccine supply chain and cold chain to make sure we're getting shots in arms around the world. Personally, this is a passion project of mine, as you may be able to tell by how I'm speaking about it. And we're working with our partner countries to make sure we're getting them vaccine. Syringes are a big choke point right now in the supply chain, to make sure that we're able to vaccinate the world's population. We're not going to be safe from this, and this is not going to end until we end it globally. And that's a really important point. And so thank you for whoever asked that question. All right. Can a vaccinated person still transmit COVID-19 to others? So I have to be careful when I answer this question, because if we talk in absolutes, I'm not going to say that someone who's vaccinated could never transmit it, but they are far, far less likely to transmit it. So of the 160 million vaccinated people in the United States right now, the CDC is tracking about 9,000 breakthrough infections. So in other words, of the 160 million people that got vaccinated, 9,000 have gotten COVID, and just over 100 have died. So these are very, very small numbers when you consider what the infection rate for COVID was in unvaccinated people and what the death rate was in unvaccinated people. So it's not an absolute, it's not 100%, but it's pretty good. It's probably the best, or one of the best vaccines we've seen in terms of fighting a coronavirus or another virus that has the mutation rate that this virus does. So very good question, but definitely something that we need to emphasize. You are far less likely to transmit it when vaccinated. All right. How effective are the current vaccines? That's a great segue. Vaccination. So the Pfizer and Moderna vaccines, the mRNA vaccines, have about a 95% efficacy rate, which is a pretty good efficacy rate in preventing infection. We've seen that borne out in the clinical trials. They got them approved and then confirmed in subsequent studies. The J&J vaccine has about an 80% efficacy rate. All of them have close to a 100% efficacy rate in preventing hospitalization or death from COVID. So that's a very important distinction. So while you may have a 1 in 20 chance of spreading COVID or getting infected with COVID and having an asymptomatic infection by the clinical trial data, you have a minuscule chance of getting very sick from COVID after getting vaccinated. And so that would take COVID, if we vaccinated the entire world, that would take COVID from a deadly threat down to the level of something along the lines of a flu illness or a common cold, where it would be an acceptable risk tolerance that we could resume our economic activities without much thought, because the risk of suspending economic activity in order to prevent the small amount of deaths in a vaccination population would result in actually more harm to the world and to society than just continuing business as usual. So I think we've got to be really, really aggressive about vaccinating people, because it is going to be the future and the economic recovery of the world. Do you think we'll ever be able to eradicate COVID-19, or will this be around forever? I think it's probably around forever. I don't think, when I say that though, it doesn't mean that it's around in the way that it's been. If you remember what we were like in early 2020, it's a much different disease than it is now. And so I don't think we're going to have the same kind of society stopping pandemic that we've had before, but I don't think we're going to be able to wipe it off the face of the earth. We've really only been able to do that with one disease process, which is smallpox, and we've gotten really close with polio through vaccination campaigns. It's only in 2 countries in the world right now, Afghanistan and Pakistan. But COVID-19 is probably going to be one of those viruses that circulates with the seasonal viruses that does affect some people, but the vaccine is going to protect most of us from serious complications from it, and will hopefully reduce it to the level of an annual flu, seasonal flu outbreak, or even better, a common cold. All right, let's see. So how can we create more equity and better access to vaccines in the United States? So I think making sure that vaccines are accessible at every point where people get healthcare. This is a challenge. Putting them in doctors' offices is going to be a challenge. Getting them into free clinics, I would really like to see vaccination offered at as many healthcare points as possible. You know, as an emergency physician, I'm very proud that our health system has actually started offering the J&J vaccine to people in the emergency department. They're going to be discharged, so they'll get their vaccine on their way out of the ED, and that's it. They're vaccinated. That is definitely one of the areas where you know, I think we need to expand access, and creating that equity is bringing the vaccine to people, not asking people to come to the vaccine. And that is the challenge of the summer of 2021, really, is to make sure that we get it into as many doctors' offices, as many mobile clinics, as many access points as possible. I mean, I'm one of these public health nuts that even says we should have it in grocery stores. We should have it in places where people do all of their activities of daily living, so that we can, it's almost a, it's just a cognitive step to just say, yeah, I'm going to get vaccinated today. And they really don't have to take too many physical steps to get to it. A great question. So what do you think about employer vaccination sites as a way to reach people where they are? I think that's a great question. And I think that's a great suggestion. I think, again, having that cognitive step and just saying, okay, I agree to be vaccinated should be the hardest part. That should be it. So having it in places of employment, having it at the grocery store, having it at pharmacies, having it at doctors' offices. You want to make sure we meet the balance of people feeling like they've had their questions answered, but that when they decide to get vaccinated, it's accessible. They don't have to go on a bus, they don't have to take a train, they don't have to drive a car. They're there wherever they regularly are. The vaccination's there, and I think that's a goal for, like I said, for the rest of 2021. All right, let's see. What do you think the next phase of the pandemic looks like? Will we see another hard fall and winter? God, I hope not. As someone who's taken care of COVID patients since March 1st, 2020, I really hope for myself and for my fellow healthcare workers that we don't have another hard fall and winter. I really hope that we're over the hump, that the variants are still under control by the vaccine, that we don't need a booster starting in December, that we get a little bit more than a year's immunity. I mean, we're preparing as a health system. I can tell you, Northwell is preparing for a third surge. We hope that we don't need to use any of the preparations that we've made, but it's definitely on our minds. I think that if we got to 70% or higher, it's really hard to see from an epidemiologic perspective how we would have a winter as tough as the one we just had. I think that the winter we just had really was just not getting production of vaccine high enough and getting it into arms fast enough to prevent the deaths that occurred over this winter. So I hope that we can, and I hope that we stay serious about this, remember the people that have died, and the way we remember them and honor them is by getting vaccinated and ending this pandemic. So I'm really hopeful that that will happen. We will continue on this path, and that we will have a normal, whatever normal is now, normal 2021, 2022 winter. What would you say to someone who's afraid to get vaccinated? I think, so number one, I would validate their fear. There's been a lot of talk. There's been a lot of politicization of COVID. And I would say, look, you have a right to be afraid. Let's go through the facts. Let's address what your concerns are. Let me know what you're afraid of. Because as someone who's seen both things, I'm scared to death of COVID still. I mean, I want, like I said, I wanted to sign my kids up for clinical trials and get them vaccinated, get my 4-year-old vaccinated. I don't like this virus. This virus and I are enemies. And so I've seen what it can do. And I've seen many, many people vaccinated. I ran a vaccination center in New York State during the winter of 2021. And, I've taken care of many people that have gotten vaccinated. And, the comparison is not even close. I mean, the amount of protection the vaccine offers compared to the risk, and the amount of risk people have with COVID is tremendous. I have colleagues who are young, healthy ER docs that got COVID and now have pancreatic failure and are giving themselves insulin injections. I have friends who have, eye problems that have persisted after COVID. I have friends that are just, still feeling the effects of COVID long after the virus left their system. So, I'm very, very passionate about this, and I think that we all need to be. But I think we need to respond with understanding, tolerance, and support, because I think, like I said, this is an easy decision once you're told the facts. I think you just people need to stop screaming on both sides of the political spectrum about things and just explain to people, because 90+% of Americans are reasonable people, and when they hear the facts, they're going to make a decision that's a good one. Anyways, I think we have time for maybe one more question, and then we're going to wrap. But these have been great so far, so let's keep them coming. Are you optimistic about the future of this pandemic and public health? I really am. I think we've seen some really dark times in the last 18 months. I think that like many dark periods in our countries, in our world's history, some of the greatest achievements have happened after them. And I think that this puts a direct relationship between public health and spending money on public health to prevent things like this from happening. It really puts a point on it. And so I think we've learned a lot from this pandemic. We've understand that emergency preparedness is not just some game that you play on a tabletop, that it's really, it's life or death, and it matters. And I think that we're going to see a renewed sense of determination in vaccination campaigns, in fighting vaccine hesitancy, and in promoting public health that's equitable, that really reaches all communities. Because we're not safe until everyone is safe. And that our interconnectedness has really been shown in this, from the community level all the way through to the country level. And as much as the political pundits like to talk about what's going on in America, what I've seen in America has been tremendous generosity, tremendous tolerance, and tremendous community building. And I hope we can take those positive parts and really extend them. And right now, I think the focus needs to be on the rest of the world, because as we're coming out of this, like I said before, the rest of the world is on fire. And we need to help them with vaccination, and we need to end this pandemic for the world. So I think with that, I'm going to wrap. It was a tremendous talking with you all today. Your questions are insightful and positive. I hope you stay safe. I hope you have a much more normal summer in 2021 than you did in 2020. And hopefully the next time I meet with you to talk, we won't be talking about COVID anymore. We'll be on to the next topic. So with that, have a great afternoon.